It's not like on the telly where you turn to the camera and say time of death.
Hello, welcome to the Coffee on Call Medicine podcast, a podcast series to help ease your transition from medical school to foundation. So sit back, put away the textbooks, and grab a coffee. Enjoy.
Hello, welcome to Coffee on Call, the Foundation Medicine podcast. I'm Rachel, and I'll let these two introduce themselves.
My name's Kitty.
And I'm Imi.
So during this podcast episode, we're going to be talking about death and dying. So, the D word, taboo or not taboo?
I think taboo, but shouldn't be taboo. It's sort of how I'd phrase it. I think throughout medical school and kind of in the medical culture, certainly amongst doctors, it feels like it's quite a taboo subject. We all know that it happens, but we don't really talk about it. Or it feels like it's not really okay to talk about it. It's meant to be part and parcel of being a doctor. You deal with it, you move on. That's kind of, I don't know if that's your experience, Kitty, but that's how it feels sometimes.
Yeah, I agree, and I suspect that's more so in some specialities than others. So perhaps specialities that deal with death more, it's less taboo. But I would agree with everything you're saying, and I think particularly when it comes to those conversations with patients and relatives, is people don't always say the D word, and I think it's so important too.
How do relatives respond when you mention it?
I mean, you know, these conversations are always hard, but I think if you can be honest and you can be pragmatic, I think they appreciate that, and they appreciate being allowed the time to have the kind conversation, to receive the kindness, and to have the opportunity to grieve. I think it's really important to be comfortable saying the D word, saying death, saying dying, because I think patients and relatives can pick up when you're not.
And I think coming on from that, the speaking with relatives about it, how do you guys approach that? Because it's a really difficult conversation, isn't it?
I think sort of everyone has their own style, as with the sort of soft skills we've talked about in other episodes, but certainly a warning shot I think is really important. So you're not going to walk in the room and blurt it out. And I think sometimes if maybe it's your first time having that conversation, or you're nervous or uncomfortable, I think the tendency can be to speed up what you're saying, because you're trying to get out of the room and sort of rush out the message, as it were. But I think certainly if you're having that conversation that someone is nearing the end of their life, you need to gently bring the relatives with you, because they might not be from a medical background. They might know their relative looks unwell, but they can't quantify. You know, we're trained to look at people and assess all the parameters, their past medical history, and go, yeah, this is looking to be the end of their life. And other people aren't in that know, so I try and lead them without using jargon through the story. So I say, you know, obviously you introduce yourself, you check who you're talking to, what's your understanding of what's happened so far, so you can establish what page are we on. And then I start talking to them and I start saying, you know, they came in with this, we've tried to do this, but they've gotten sicker, you know. And then often it becomes a conversation of, you know, so that their heart's not working very well, their lungs aren't working very well, and all the time, verbally and non-verbally, you're slowly giving them the signal that bad news is coming, okay? And then you can say, so, you know, for example, this is what we call multi-organ failure, you know. So this will be the end of their life, you know, they are dying. And then once you've said the D word, which is really important, so there's no ambiguity for them, you give them time, yeah? And if you've gently sort of, I call it kind of waterfall down to that news, then let them sit with it and have whatever reaction they need to have. And actually, less is more, you know. Sometimes they just need to say if they're sad, if they're angry, you know, you give them that time, because for them, that might be quite a shock. Whereas for us, we know going into that conversation that that's the news we're going to give.
Yeah, I think you're absolutely right. I think if you can, you know, have a bad news conversation, have a death and dying conversation like that, you know, those relatives will leave with the appropriate emotions of, you know, this is a really sad situation, but actually I've got the opportunity to spend the last few hours of my relative's life with them. I think the tip I would give when you're thinking about breaking bad news or having these end-of-life conversations is actually take the time to plan what you're going to say before you go in, and just how you're going to say it and how you're going to walk them through that conversation. And if that involves having a conversation with your reg or your consultant about what you're going to say, then do it, because the more prepared you are and the more comfortable you are with what you're going to say, the more comfortable the family and the patient will feel.
Yeah, I would definitely agree with that. You know, pauses are so important, and planning that out, that you guys might have those conversations on a regular basis, whereas for that family member or that patient, that might be the most important conversation that they're having. So what about when you're confirming death? How do you guys find that and deal with that?
So I think it might just be worth saying what confirming death entails for those that don't know. So when a person dies or they pass away, there are certain checks that we need to do as a doctor to confirm that has happened before the body can be taken to the morgue, and, you know, sort of the next steps in terms of burial, etc., can be planned. So we do things like we check for a verbal response, we check their pupils, we listen to their chest. The whole process takes roughly about 5 or 6 minutes. And it's a very common job you'll be asked to do as one of the juniors.
And actually, as one of the juniors, I've certainly found that I've, by and large, confirmed death of patients that I've never met and that I don't know.
And that's a good point that you've raised. You find that it's different when you're confirming a death of someone you know versus you don't?
I think so. I think when it's someone you don't know, you almost feel a bit more detached, and it very much feels like a medical, you know, something that you do without a huge amount of emotion attached. But when you know the patient, I think it's difficult not to have that emotion attached to confirming death.
Yeah. Would you agree with that, Amy?
Yeah, I would. I think because often people die overnight, for example, or sort of out of hours, that's when it's going to be someone you don't know, and you'll get the bleep or the phone call that says, you know, Dr. Bed 2 has passed away. And that can be quite challenging, just in the sense that you might then have to deliver that news to the family if it was unexpected, for example, and you've never met their loved one when they were alive. So you're kind of reliant on reading the notes and speaking to the nurses to then have that conversation. The actual act of doing the confirmation, I think I'd agree, is easier if you didn't know the patient when they were alive. I think it's something that I found quite intimidating before I'd done it, because it feels a bit strange. You know, you go in the room and there's someone who's passed away and you've never met them, and I think you feel a bit sort of uncertain about, you know, I'm kind of play acting, I don't really know what I'm doing. It's not like on the telly where you turn to the camera and say time of death. But I actually think it's one of the privileges of being a doctor that I like to think of it as that's the last 5 minutes I can give this person. And then when I meet the family, I have met their loved one, you know, and I've got at least that little bit of connection.
Yeah. And if you can do that sort of final act with dignity and respect, then that's the absolute most that you can offer to that patient at that time, and the family.
I completely agree with that. And what about having the family there? Are they in the room with you? Have you experienced that?
I know different people who do different things. Sometimes I've known junior doctors ask family if they would like to be in the room or not, and just gently explain to the family what confirming death is, why it needs to be done and what it involves, giving the family the options. And I've also known other juniors that have explained that this needs to be done after death, and would they mind leaving the room for 5 minutes. And I think relatives don't mind either way from experience.
I think as well, sometimes there are cultural differences. So in certain religions and areas of the world, it's quite important that there's sort of a named member of the family, for example, who stays with the body. And sometimes, you know, in certain scenarios, that person needs to be buried very quickly. And, you know, it's one of the unique things I think is really interesting, that you get to learn about these different practices and the culture around death, from quite a unique position as the person who gives that news and confirms that person has gone.
I think you do absolutely right by bringing in side of things and actually exploring those cultural norms after death with the family, either before or immediately after death, is really important.
I think it's also worth exploring visiting the mortuary. Is that something you guys have had much experience of?
I think so. Visiting the mortuary is something you might do if you needed to go and confirm that the identity of someone who'd passed away. And sometimes people have to do it to confirm, for example, if your loved one was going to be cremated, we need to check that they don't have any devices like a pacemaker still in their person, because that has quite a high risk of causing an issue at the crematorium. So sometimes people visit to confirm the ID, to check there's not a pacemaker. I personally have only done it as a student, as part of learning, so sort of seeing post-mortems. I don't know about you, Kitty.
No, I have visited the mortuary as a junior doctor, and actually I've generally found it much more uncomfortable than having those end-of-life conversations and confirming death on the ward. I think because it's a different environment to one that you're perhaps not normally in. But actually, after someone dies, they are taken to the mortuary, and that's an entirely normal procedure. So it's really important to almost swallow that discomfort and actually accept that this is something that you have to do to continue the care for that patient.
Yeah, I think that's an interesting point. I think it's kind of a hidden part of the pathway, isn't it, in the care of the patients, but one that's equally as important. So what would your takeaway tips be then in terms of dealing with death and dying and having that experience as a junior doctor?
I think my first one is, when it comes to end-of-life conversations, take the time to plan what you're going to say, how you're going to say it before you do it, and take the opportunity to speak to a senior before you do it. And I think the second thing I would say is it's all right to find those conversations hard and emotional, and make sure that if that's the case, you have the opportunity to speak to a senior, a colleague, a friend, just to walk through those emotions.
Yeah, I think those are both really good. I think you might have stolen one of mine there.
Sorry.
No, like you said about being comfortable with it, it's a natural part of life. It's a natural part of our job. And I always try to think, I can't change the outcome, they're dying or they have died. But what I can do is I can give this family all the kindness that I can in this moment and tell them in the nicest way. So I try and think, if it was my loved one, how would I want to be told? Would I want to be in the corridor? Would I want to be in a nice room with some of the nursing staff and someone to take my hand and say, I'm really sorry they have died, and give me the time? And that's all I can do. So I think it's giving them that final kindness and dignity.
I think you're right. I think what you've highlighted there is actually you don't want the family and relatives and patient to go away thinking that was an awful conversation. You want them to go away thinking, gosh, this is a really hard situation, but we've got the opportunity to spend the last hours or days of our loved one's life with them.
Yeah. And no, I think you've both said that really well. I think my final point would just be that dealing with death and dying, if you do it well, it's a real privilege. And it's something that, like you said, the family members can take away as, yes, this is a hard conversation, but I've had the time. Use that privilege. It's something that we have as doctors that not every professional will have. Yeah, thank you very much.
Thanks,
Thank
guys.
you.